As a military psychologist, I was deployed at the outset of the Iraq invasion in 2003. So I was part of a field hospital that provided neuropsychiatric services to people coming off the battlefield. And but most of my time was spent not on deployment, but it was spent in garrison, working at hospitals and clinics. On the more on the home front. I was stationed in Japan, so we got people coming back from the sandbox right to directly to Japan. One of the things I did right after the Iraq invasion in my deployment is I went and surveyed 133 military mental health providers. See, people like me who wore uniforms, psychiatrists, psychologists, social workers, who are the experts, right? The subject matter experts you would expect. I was just asking how many had been trained on specifically on how to diagnose and treat PTSD, and 90% had not received specific training. We use psychology to develop ways to efficiently train people how to kill. We haven't applied that same research and emphasis on how to help people kind of best deprogram that. We're reinventing the wheel every generation at a great, tremendous loss of resources and a great expense, right? Human level and financial level. And we need not do that. The precedent was in World War II when President Roosevelt mandated to the military in 1944 that every soldier would come back, and prior to being reintegrated socially, they would go through a program, a mandatory treatment program, a very comprehensive, and by today's state of the art would be progressive. And they had art therapy, they had vocational counseling, they had, a very multidisciplinary, integrated approach, included family members into it. And it was filmed and documented by director John Huston. Let There Be Light is the name of it. Was then classified, as secret and was not released into the public. There's a written record and there's a film record of the success in having the exact same kind of program that you're talking about, this reentry program, and how to do reentry right and get communities involved in this, right? And so there's a blueprint, a tried blueprint, a successful blueprint, and the question is, why do we forget it? Why don't we incorporate that into our DNA like we do the medical lessons of war or the tactical military lessons? We learn from those, we study those mistakes and what worked and what didn't, and we become better as a military tactically or become better in the medical field, but we don't apply that same level of reflection when it comes to psychiatry or trauma. And question why, it has a lot to do with the politics of trauma. And I think there's the widespread concern amongst the military planners and leaders is what they experienced in World War I, what they call evacuation syndrome, where you would basically lose so many people evacuating from the front lines because people were coming forward with some type of traumatic injury, a stress injury, that they couldn't fight any wars. So, and they were also concerned that by giving the public this type of transparency, that it would lead to an erosion of the will to fight wars or to recruit enough people to come into the military to fight wars. One of the solutions was they injected psychiatry to the front lines in order to keep people in the fighting mode. And that is the dominant treatment, if you would, of the military's treatment of war stress injury, is this frontline psychiatry. And in the U.S., we kind of led the way now. We have very good success rates. You get 97% or more people return back to duty who have broken down in combat because of an acute stress injury. Here's the peril. The policy is for frontline psychiatries, we return people back to combat until they're incapacitated, where they're so broken they're a threat to themselves or others, and that you can't rehabilitate them, right? You can't be safely put back to the front lines. So the science on this is very robust, and institutes of medicine and a lot of other government agencies have studied this, and we know exactly how many days it takes somebody to break down in the face of chronic, extreme stress in combat. And there's an algorithm that was developed in World War II that tells us how much, and it takes like 220 days of combat. Now, if you think about our deployments, we got people going over for, a year, 6 months. They're on their fourth or fifth deployment. We well exceed that.